everybody, it's Ron Rafter from RWR Dental with the Monday Chat. This morning we have Dr. Mark Kwon and Dr. Bernard Jin all the way from Vancouver and Bites Institute. Guys, please tell me a little bit about yourselves and especially about Bites Institute.
Hi, my name is Mark Kwon. Ron, thanks for the introduction and thanks for the invitation. It's a great a privilege to be sharing what we know. I'm the founder of Bites Institute. Bites Institute is a dedicated implant training organization that we started in the year 2004. Something that started as a local gathering of maybe 5-6 doctors who wanted to learn a little bit more about implant dentistry. And of course, now it has grown over and, we have ongoing on-site training program. Of course, because of the pandemic, things been slowed down a little bit, but blessing the disguise, we use that opportunity to share our knowledge and passion globally. And we've been, we have over almost 5,000 followers in our Facebook group as well, which is our main route of exchanging information and getting to connect with one another. We're based in Vancouver, but we've trained doctors across Canada, Calgary mainly, Edmonton, and in the past Toronto as well. And of course, with the training, we always want to get our feet wet with the newest and the greatest technology that the science can offer. And Ron's been great. Quicksleeper has been one of those instruments that became a necessity part of our daily routine. So thank you, Ron, for opportunity to introduce myself.
You're very welcome. Dr. Jin?
Thank you for the opportunity, Ron. Just a few things. I'm just honored to be standing next to Mark, but basically also co-teaching with him. Bites Institute is a institute that is basically geared around providing implantology training to dentists all around. Our main focus is, of course, directed at general practitioners. However, we also have specialists who take our programs, and so it's been a privilege. It's been a wonderful ride. I do believe that we're one of the few organizations that invests in our doctors with no nonsense, everyday practical strategies and tips and approaches. Our institute is not necessarily geared around purely techniques, but rather it's actually geared around a philosophy of patient-centric therapies. Basically, everything is geared around what is best for the patient. And so, it's been an honor. I thank my colleague Mark for the invitation. I joined Mark in co-teaching around 2009, and it's been a pleasure.
Thank you.
Awesome.
Thank you. Same
Thanks,
with
guys.
you.
Again, just getting into the Quicksleeper, maybe your first experience, Mark and Bernard, with the Quicksleeper?
I got introduced to Quicksleeper by one of my close colleague. His name is Dr. Mark Lin. He's a renowned prosthodontist in Toronto. I think many of you in Canada know about him and trained by him. Fantastic speaker, presenter, and clinician. And we had an opportunity to share a stage at PDC, Pacific Dental Conference, which is one of the largest conference in Canada. And they have the highlight of always the conference is the live surgery stage, which I've been part of for many consecutive years. And Mark Lin, I decided to do one stage where we collaborate and do a stage together. And then he calls me up, a few days before the conference and say, Mark, I want you to use this Quicksleeper. You should try it on. I said, you know what? His name is Mark as well. So I saw, tell Mark Lin, I say, Mark Lin, listen, I only have a few more days to prepare for the stage. I don't want to throw another wrench into the whole equation, I'm already stressed out as it is. Oh, no, Mark, you're going to use this in your own practice. It's one of those things that actually works. So I got the unit from Ron. I practiced a couple times and I went on the stage and I performed it. But to be honest with you, it was such an easy equipment to get used to. And I've worked with a similar equipment, such as the wand, the slow injector, painless injector, and the Stipton, which is intraosseous. But the difference was that Quicksleeper was so sophisticated in its design and its delivery that it's all in one unit, right? And I got more doctors asking me about that unit on that conference after the live surgery show than the actual surgery I did myself. So that tells something, right? And you know, when as a clinician who's been doing surgery in dentistry for over 25 years, you know, you come across with a lot of sales rep, you know, pushing products into review and things like that. And you do it with a grain of salt because many of them don't meet your expectation. But there's only very few that actually not only meet your expectation, but surpass your expectation. And a Quicksleeper is one of those very few that you are lucky to come across and you actually end up loving it. And, you know, you actually, you know, utilize as part of your workflow, surgical workflow, pretty much daily, you know, for me anyways. So it's been fantastic.
That's awesome, Mark. And Dr. Jin, could you continue with that? And also maybe your first experience. I believe I was present at that experience in the evening.
Yes, absolutely. All right, so I had obviously seen Mark use the Quicksleeper at the Pacific Dental Conference, live surgery stage. It was exciting. But then soon after, I remember we were running an evening study club, and we had talked about showcasing or introducing the Quicksleeper tool to our doctors. We had, I can't remember, approximately 20 to 30 doctors attending, and we're talking about in the flesh, real live doctors that were going to actually see this product. However, before we made the introduction, I had asked Mark, I said, well, if we're going to introduce something, I need to know just how good this device is. Because I don't necessarily believe in just talking about a product with which I have had no experience. And also I need to know if the claims are true, if this product truly is painless. And so that afternoon before the study club was in the evening, I basically approached Mark and I said, look, if we're going to introduce this product or talk about this technology with our doctors, you need to do it on me. So let's go. So I had Mark administer the Quicksleeper anesthetic on myself because I needed to know, without a doubt, how it felt and whether or not the claims are true. And lo and behold, it was. It was basically, I think Mark had done the Quicksleeper injection, and it was done in my, I believe it was my lower right molar, and it truly was painless.
Fantastic. What's the experience or the feedback, guys, from your patient experience with the Quicksleeper?
The Quicksleeper, I think a lot of people don't fully understand, you know, what makes Quicksleeper so great. You know, a lot of doctors just think about from in terms of, okay, does it really work? You know, is it better than traditional injection device? So if you're just looking at that from purely functional perspective, it does not justify spending the cost to purchase the Quicksleeper, because in some ways it is slower, it is more to prepare. It will slow you down in some sense, you know, utilize Quicksleeper. But what Quicksleeper brings to the table is a very positive patient-doctor experience. It helps you slow down so that patient don't feel that doctors are rushing you during the injection, because every patient says that the worst part is you know, getting the injection, right? So by physically slowing things down, it calms the patient. That's the one advantage. Second is, you know, a lot of people, I know the company likes to focus on Quicksleeper about intraosseous, how profound freezing, but I'm going to go on my limb and focus on something else. It does, I think, is more important. It is slow injection ability. I think that alone is well worth the sticker price, in my opinion. Because some of you guys have probably experienced about the wand, the slow injection device. And initially I thought it will be, somewhere probably comparable to that slow injection device, but at a much higher cost. But no, I was wrong. It was way, way more effective than the wand. Not even a comparison level. I've used the wand in my past, and I've used a Quicksleeper. I think Quicksleeper is a lot more finer control. And also the needle tip is different. The bevel tip, that also really diminishes the entry of the needle into the tissue area. So if you use properly, I think the slow injection, especially the area of where I like to use for all my anterior cases, is incisive freezing, which is probably the most painful freezing in my opinion, because I get those injections done when I get my teeth worked done at the front, palatal injections, and also central when I'm doing immediate implant on the central incisors and laterals. Those areas, I think it really, really shines. Of course, once in a while, I'll use intraosseous as well. I don't use intraosseous as much as probably a general dentist would use. Okay, I think I said there's definite benefit to that in a small area, but I use intraosseous when I'm doing a surgery where I just cannot get the freezing in with other means. I will do intraosseous and get a profound freezing right away for a duration of time that I need. So it's about control, I think, in my opinion, predictable control and positive patient experience is where it's been. And for me, it's to a point that some of my patients say, you know what, Dr. Kwon, can you tell their referring dentist, their dentist to buy one of those, okay? That's demanding it, right? They're demanding it, right? So it's not like, so that puts me in a very hard spot, because I'm a person who gets referred from the doctor, so I don't want to go and say demand that. But what does that say, right? This product helps to build a relationship of the patient's trust to the clinician, and there are not that many product that does that. Okay, and pain is a very, very intimate sensation in a negative way. Right. And so if you can take that negative experience out of the equation, I think, that really helps to retain the patient pool, or also help to develop a referral network as well.
Mark, that's amazing. And we've heard that many times. It's been really a game changer for a lot of practices. And I know for you also, Dr. Jin, you've had quite a bit of experience, I think more intraosseous than Mark.
Yes. The Quicksleeper, just to continue with Mark's train of thought, I do like it because patients don't see it as a needle. They don't perceive it as a needle. The design of the unit is very non-threatening, at least for the patient's perspective. It just looks like a pencil or a pen, and you're holding. And so when you're talking to patients, very often my patients are not even aware that I'm administering local anesthetic in their palate. Very often they don't even feel the pressure because of the way to the design of the needle, the way it's administered. I mean, mind you, you need to know how to use the product. You can't just arbitrarily pick it up and start going at it. But once you know how to use the product, it's a very straightforward product to use. It's very predictable. Patients generally like it. It's not threatening. And by the time the palatal freezing is done, for example, as Mark had alluded to, patients are surprised at why and how it didn't hurt. So that's a good plus. In terms of using it intraosseously, yes, it's a wonderful tool. It's a wonderful device. I too have been familiar with the wand and the Stabident system, the intraoral system, and I can say it's not even a fair comparison. But hands down, the Quicksleeper is a superior product. It gets the job done, whereas with the other products that we talked about, it's a hit and miss. And also, it all depends on the situation of whether or not you've got the right target. Whereas with the Stabident, because of its design and its actual penetrating design to get intraosseous, I find it's a lot more predictable. I don't know if I necessarily agree with Mark about the slowness of the procedure. I have on occasion taken out a lower molar with just the Quicksleeper and place an implant with the Quicksleeper. Because the patient was extremely phobic, didn't want a fat, numb lip, and I convinced the patient to let me try this. I was able to extract the tooth, place an implant, all within a span of 30 minutes. And the Quicksleeper allowed me to do that, so it is a decent piece of technology, and it comes down to knowing when to use it. Mark does a lot of big cases, and so that obviously he has to weigh that in, because for him, duration of anesthesia is extremely important. But if you need a quick solution for a very brief period of time, the Quicksleeper can be there for you. I've certainly done that, and I do recommend it.
No, when I say the quick delivery is the delivery is quick. Well, actual process of injection is slow, but the onset is very quick. I think, and however, like what slows me down is when I have to do a multiple injection with the Quicksleeper, because you have to wait for it to rewind back, all that. But it's part of technology, right? Part of technology. But the learning curve is pretty short. And I think for doctors is, there's always a skepticism of trying to invest in something that they already think that they already don't need. They feel that when they're doing injection with their, existing, the conventional needles and syringes, and they say, why do I need to invest in something that it already works? So sometimes, that is a barrier. But I tell my doctors that, what, you don't know what you're missing until you try it, right? It's one of those things, like it's a bicycle versus an e-bike, right? Why do I need an e-bike, right? Well, it gives you a different added value and an added technology to it. But it's like a lot of things in dentistry, like once you use a CBCT, you can never go back to implant without a CBCT scan. I will never do anterior implant without grabbing a Quicksleeper first, because to me, when a patient says in a conventional, I say, Dr. Kwon, freezing was the worst part of the whole procedure, right?
Sure.
That tells you something, right? But when I take that negative experience away and start with the Quicksleeper, and they say exact same procedure, they say, Dr. Kwon, I didn't feel a thing. That's something, right? That's something, right? So, and I tell the patient about, it's always a good to talk about Quicksleeper. I'm going to use a Quicksleeper on you, and this is what they use on children. If they're good for children, I'm sure it's good for you. So it eases their anticipation as well. So it's been a great patient management tool. I think that's one of the most underappreciated value of this little device, right? And it's easy to use. There's no cord. The foot pedal it doesn't tangle on me. I already got a ton of foot pedals that will mess me up. So having a cordless, it's easy to use it, and it's easy to transport from op to op if you don't have each device on each of the op. Yeah, it's something that I use it all the time. I depend on it, really.
Dr. Kwon, thank you so much. And Dr. Jin, any last words? We're up against the clock here, so.
Sure. Just a little thing about Quicksleeper. First of all, thank you, Mark, for the opportunity of working next to you. So Mark had invited me to join his practice and to serve his patients. But prior to that, I had my own dental practice. For 25 years, I've been having my own practice in Coquitlam. And when I sold my practice, part of my conditions was that I get to take a few of my favorite tools with me. And interestingly, and I'm not making this up, this is for real. I part of the conditions of my sale was that I get to take along my Quicksleeper. And I had bought 2 units, remember, at my office, my original office, but I wasn't gonna leave with no Quicksleeper. And I took one with me. And so when I joined Mark at his practice, I brought that Quicksleeper on, and we're chugging along with that because I couldn't imagine life without it. So I do think that it is a valuable piece of technology. I think the clinician and the patients will definitely benefit from that. And yeah, it's a great piece of product. It's a great technology.
Yeah, I
Gentlemen,
remember.
thank you so much. Mark, sorry, one last word.
Yeah, I remember Bernard. It is true. I can vouch for that. He brought Quicksleeper and his camera, his Canon 5D Mark IV, because that's his baby. So he brought those 2 in. And I said, what did you bring those? He goes, well, these are the part of my contract that when I sold it, I'm going to keep it. So he brought it in, and we have it in 12-hour ops, use it all the time. But my final thought is that I think general dentists will find them way more use than me and Bernard, because we're a surgical center. We use it, but I think general dentistry, where there's an array of a patient from a child all the way to a full big elderly patient, I think there's going to be way more utility to it, and interest osseous, I think, will come in a far more frequent uses, in a general practice setting. So if we find that useful in our surgical center, I think that they're going to find a lot more application in a general practice setting. My recommendation is give it a try. Right? It's like give it a try. If you don't like it, return it to Ron. Okay, he'll take it back. But I promise you, once you get a taste of Quicksleeper, you're never going back. Right? Anyways, thank you so much. No equipment is perfect, but and nothing is. But you buy for its benefit, not because of its, you don't buy it because of its downside, but you buy it because of a very unique feature and the benefit that it offers. And Quicksleeper definitely has quite a few of those. So Ron, thank you very much for today. Thanks for the invitation.
Dr. Kwon, Dr. Jin, thank you so much for taking the time. I know it's a very precious day for you. It's your off day. So thank you very much for taking the time and sharing your knowledge with the Quicksleeper with us.
Wonderful.
Enjoy.
All right, Ron. Take care.
care.
Bye-bye.
Bye-bye.
Stay healthy.
Bye now.
Thank you.